Nurses, doctors of Reddit. What's the rarest, least common medication you've ever had to administer and why? Story 1. In 15 years of hospital pharmacy, I've twice had occasion to dispense thalidomide. It's used as an end-stage anti-nausea med and comes very carefully packed, with all sorts of warnings about not coming near it if pregnant, and even as little pictures of thalidomide babies. Story 2. I had a woman who was on ziconotide, which is an analgesic derived from cone snail venom. If it isn't administered correctly through the spine, it causes hallucinations. Story 3. I gave an old man a one time when he was demanding a sleeping pill. Blood pressure was too low, so doctor wouldn't order a real one. Worked great. Edit getting comments that this is unethical. Please realize that this was done with the patient's safety in mind. In a real-world hospital, safety is always the first priority. Things aren't always as clean, neat, perfect, and morally sound as they are on Grey's Anatomy. Also, I've done this maybe twice in 11 years. This isn't common practice, and it has happened in very, very special circumstances when the family has been aware and agree to encourage it. I don't just go around lying to patients and giving candy instead of medicine on a daily basis. Story 4. Methylene blue. I gave it to a girl who tried overdosing on Orgel. The active ingredient is benzocaine, which caused her to develop a methemoglobinemia, treated with the blue drug. It truly is an artificial-looking bright blue, and I gave it to her in her 4. Story 5. A fecal transplantation. At my first internship during nursing school, there was a patient with a bowel infection caused by Clostridium difficile a few months before he got treated with broad-spectrum antibiotics for pneumonia, which caused the infection. They tried other treatments to cure the infection, but nothing worked. Eventually, the patient got accepted in a clinic trial for a fecal transplant. One of his kids was the donor. After the transplantation, the infection actually cleared up. Story 6. Sodium thiopental serum. In residency, someone had a conversion disorder in a movie theater I know, way back when it was a normal thing to do. The entire place cleared out after the movie. His buddies are talking and realize he's not getting up. He finally tells them he is paralyzed and can't move. Medics brought him in. He's laying in the gurney in the sitting position like he's an astronaut. I walk in the room and think to myself, what the fuck? I go ahead and take his history, go back and present him to my attending. Attending asks me what I want to do. I'm at a serious loss here. I have no clue other than wait him out. No, but his core is that strong. He says we should give him thiopental. Of course, I say, let's do it. We go in with just us and a nurse. He turns the lights off. The nurse pushes the meds. My attending proceeds to walk this guy down with confidence and empathy, like he's walking him through the worst LSD trip ever. Sure enough, my attending asks him to realize that his arm is attached to his chest, which is attached to his back, which connects to his neck, which connects to his brain. He tells the guy, now is the time to move your arm. The kid moves his arm. Amazing. After a bit longer, the kid is lying flat. Soon enough, he's up and moving. Craziest I saw that year. Emergency medicine. Still not dull 10 years later. Edit darn grammar mistakes. Story 7. Maggots. We had a drug addict come in who had let an infection go so long in his arm from repeated needle usage that all our attempts to clean it failed. We ended up using maggots to eat away the dead tissue, while leaving the healthy tissue intact. Dude just had an open wound full of maggots loosely covered in some gauze for like several days. The worst part is always having to collect them afterward. The medication most people are shocked by is cocaine hydrochloride. Yep, cocaine, it's a good vasoconstriction agent and topical anesthetic. Story 8. Respiratory therapist. I gave nebulized morphine to a sweet old lady who was dying very painfully in front of her family. There were about 12 of us in the room, including me. The PA for the pulmonary group that was covering the ICU for the weekend that ordered it, and her family. 12 of us in a tiny room. I didn't think about it at the time because I was very concerned about it being out of my scope of practice, and because it was the weekend, I didn't have a chain of command to really ask. But you know, nebulizing an opiate in a tiny room with a lot of people. When the PA and I came out after 4 minutes and the treatment was finished, I said, I felt kind of funny, and the PA laughed kind of weakly, then sat down. My pupils were pinpoint. We also used a nebulized vodka for pulmonary edema, although I've never done it, so can't vouch for it. Story 9. NICU nurse here. Aminol. I've had to give it to 2 different patients. It's a medication to help with really high blood ammonia levels with kids who have certain metabolic conditions. The medication is extremely expensive. Story 10. It was many years ago, and I was working with end-stage cancer patients. This one woman, who began her treatment outside of the United States, was given a mixture of cocaine, heroin, alcohol, morphine, phenothiazine, and some other antiemetics. It was specially made into a liquid and imported from somewhere in Europe. I remember this med so vividly because it's not every day you give someone heroin. I think it was called something like Brompton cocktail, and the lengths that were gone to check out and administer a dose of that stuff. We're talking who's got the nuclear codes type of system. I have to admit, though, it worked like magic. Story 11 medical maggots to chew up the dead tissue off a diabetic patient's foot. I was an intern when my attending wanted to use maggots on a patient. The nurses refused to change the dressing and would page me to do it. The point said he would hear chewing in the middle of the night and that his foot kind of tickled. Story 12, just a med student and not sure how rare it actually is. But I've seen arsenic trioxide prescribed once for a patient with acute promyelocytic leukemia. I think another arsenic compound is used to treat sleeping sickness, but that's about the only diseases it's used for these days. Once upon a time, it was the best treatment we had for syphilis. Story 13, not a doctor or a nurse, but analytical chemist for a small-scale bespoke pharmaceuticals production company. How to stock control our CD's control drugs and dispose of about 10 g of out-of-date pharma-grade cocaine hydrochloride that had been used once. Apparently, it could be prescribed as a mouthwash for numbing the gums. Story 14, not me, but one of my nursing professors told the story of an alcoholic who was so deep into his addiction that the doctor prescribed a cup of wine every 8 or 12 hours or something to keep him from going into fatal withdrawals. Naturally, the hospital did not spring for a nice bottle. Story 15, synthetic blood, Melbourne, Australia, and I think it was a world first at the time. We had a trauma patient who required a blood transfusion. She couldn't accept blood products, however, due to her religious beliefs. So synthetic blood was shipped in from the U.S., ended up saving her life. We hadn't heard of synthetic blood, so it was kind of bizarre. This was a few years ago, so I'm not sure if it's more widely used now, but I've not seen it since. Story 16, some metabolic diseases are extremely rare, but can be treated by replacing whatever enzyme is missing. I've prescribed idursylphase for Hunter syndrome. It was something like $250K per month and was covered by the state. Story 17, I had a wealthy patient who paid $70,000 on his Amex Platinum card for a 1-month supply of Harvoni Hep C for him and his wife. That was not even enough for full treatment. That was the cost every month for 3 months. He told me he had gotten Hep C from him. That is one expensive romp he had. Story 18, by far not a doctor, but a relative of mine had a lot of problem with allergic reactions, especially on the skin, where weird-looking welts would form. After about a year of trying out treatments, they eventually used a medication of which the basic component are ovaries of a hamster. They had to repeat giving him those syringes a few times, but then it was successfully treated. Story 19, IgG. It's hella expensive and only necessary for certain autoimmune issues. I think I gave it for Guillain-Barré syndrome, but this was like 6 years ago. Each bottle is $20K, I think. Story 20, not a doctor or nurse, rather the patient. I have a super rare liver disease called Wilson's disease. There are trace amounts of copper in everything that we consume. For most people, it's bound to your urine and excreted the normal way. It was the mystery illness causing all the weird symptoms twice on the TV show House. Literally, every single doctor I've come into contact with except for my liver consultant has remarked that they've never met a patient with Wilson's disease and that it is one of the diseases that they learn about in medical school because of the weird ways it can manifest. Not only that, but there are 2 different chelators drugs that help to bind copper, which are used to treat patients with Wilson's disease. The more common of these 2, penicillamine, caused me to become immunosuppressed. My immune system basically shut down, and I had to go into isolation. So, not only do I have a ridiculously rare liver condition, but I also get prescribed the less common drug that is used to treat it. It's called Trientine, and I have long lost count of the amount of times I've been asked how to spell it. Edit, this has been really nice to talk about. Thank you all for your interest and kind words. Story 21, obligatory, not a doctor, but I realized recently I was laboring under the delusion that fentanyl was 100 illegal when I was given some in the ICU. Let me tell you, that gave me pause in the middle of a high fever. Story 22, was a traveling nurse in AZ years ago. Had a kid stung by a scorpion. They flew in an antidote from NIH they were developing to give to the kid. I didn't give it, the doc did. It was treated like some kind of liquid gold. Story 23, my coworker had to use something called hyaluronidase recently. It's given sub when vancomycin infiltrates in 4, meaning that it gets out of the vein and starts pooling in the local tissue. Vanco is toxic at high levels, and it kills the tissue. So when this happens, you have to give multiple small doses of this drug with a tiny needle into the surrounding tissue to break down the vanco and save the tissue. Story 24, melarsoprol for trypanosomiasis, sleeping sickness. Arsenic compound was shipped directly from WHO headquarters to us. The patient had to be loaded with prednisolone due to toxicity, and we had to remove the peripheral catheter after each dose since it supposedly would react with and destroy the plastic. Totally wild. Story 25. I've gotten to give rattlesnake antivenin 3 times. Basically, my former hospital would stabilize the bitey by giving the initial doses of antivenin in the ED, then send them to my unit. Then I would base the decision for additional doses on my assessment of any symptoms call to poison control written protocol. It was interesting scary because after the protocol was initiated, it was up to my nursing judgment whether to give more antivenin or not, which is how any protocol works. But it was just weird following one with such an uncommon expensive 3K med. Story 26. Botulinum antitoxin. Cost about $15K 20 years ago. The vial came from the CDC and contained 4 doses. The nurse delivered the first dose and threw the rest away, not understanding there were no other single-use vials. Story 27. A common one for us in the hospitals I work with is perhexilin for resistant angina. Requires a lot of initial drug monitoring, as it's largely unpredictable without tests with how patients will metabolize it. I don't think it's used much anywhere else except parts of NZ in Australia. Story 28. I'm only a pharmacy technician, but we had one patient who needed a hydrochloric acid drip. If I remember correctly, I had never seen it before, and the pharmacist had to make sure it was in a metal container and delivered via a reinforced line, maybe glass. It was a long time ago. Aside from that, the rarest drug I've actually had a compound has probably been Xcentra prothrombin complex concentrate for bleeding. Story 29. A normal saline bolus for placebo effect. It works in many of occasions where patient complains a lot, but actually does not have any symptoms. So giving them this for placebo effect actually soothes their mind and helps them calm down. Story 30. Aqueous cocaine. My attending ordered it. I was a 3rd year and too stupid to understand his reason. Still don't know. It looked like water in a fancy beaker when it got to the floor. Story 31. A long time ago, 30 year before I qualified and was still in school, we had a patient on the internal medicine service that was suspected of having sarcoidosis. There was an old test called the Kvaim test, aka Kvaim-Siltzbach or Kvaim-Nickerson test. Basically, the test involved injecting a small blob of material taken from the spleen of a patient with known sarcoidosis into the skin of a patient suspected to have the disease. If non-caseating granulomas later form there 4 to 6 weeks later, then the test is positive the patient has sarcoidosis. It was a finicky test and subject to false negatives. There's also a huge risk of transmission of other diseases since you are injecting part of another person into the patient. Story 32. As a nurse ID, say working with milrinone, a continuous form med to treat heart failure. It's a last-ditch effort. They have to wear a pump constantly, and if it stops infusing, you have just a few minutes to get it going again. Otherwise, their CHF symptoms hit suddenly, and you better be on the phone to 911. Did not enjoy. As a vet assistant, wasn't an actual registered tech vodka for a cat that drank antifreeze. Just straight vodka. Story 33. Not a doctor, but as a kid, I had horrible migraines that upset heavily my stomach. My pediatrician medicine for that Liquoram Coca-Cola. Now, I realized it was a way for me to burp instead PF throwing up. I love that medicine. Story 34. Former pharmacy technician. In our narcotic safe was one 5 milliliters vial of pure opium tincture. Once a month, we would dispense 1 milliliter to a patient who was going through intense chemotherapy. Story 35. Not a doctor, but don't we use maggots still in some surgeries to remove dead tissue? Might not be the most unusual, but it certainly is pretty weird. Story 36. Not a nurse or doctor. Didn't have to administer anything myself, but a friend of mine went to hospital feeling awful and was diagnosed with scurvy. The doctor treating him got all the students to come and look at him as it was so unusual. UK. Story 37. AMG 509. I actually gave the first ever human dose in the United States. I've also have administered lots of phase 1 clinical trial drugs. The reason was cancer sucks, and we're still looking for a cure. Story 38. Demerol used to be a fairly common pain med, but is rarely used for that anymore. I use it once in the ED for this weird, intractable tremoring that was thought to be a side effect of an experimental cancer treatment. Only used it because the oncologist asked. That was kind of interesting. Pharmacy called me and thought I had lost my mind until I explained. Also got to give dantrolene for post-anesthesia malignant hyperthermia. It's on all the tests, but outside of maybe anesthesia, you don't see it, so that was cool for me as well. Story 39. Tuberculosis to treat bladder cancer. Not in healthcare, but my grandfather has bladder cancer, and one of the recent treatments was injections of TB. I have no idea why. I just know it didn't work. Story 40. Whiskey. I had a patient with dementia who used to drink 1 glass of whiskey every night before bed. for the last 40 years. She wouldn't settle at all without it and became a huge falls risk as she broke her hip a few weeks earlier and was struggling with her mobility. We had a doctor prescribe 25 ml of whiskey once per day and had a bottle brought to the ward for her. It was funny signing it off on her meds chart every night. Story 41, not me, but a colleague doctor, a patient of his, an old lady, was not long for this world, and her breathing was starting to fail because the nerves to the respiratory muscles had stopped working. Her family were on their way in to say goodbye, but having very little time left, the doctor had to do something desperate. He had a fridge, and in that fridge, he had a drug that had been discontinued for years, but for some reason he had saved it. Dude gave her one dose, enough for her to be able to breathe and say goodbye, which she thankfully could. Absolute mad lad he was. Story 42, I gave some of the last smallpox inoculations in the U.S. At the time, I was aware that there was more risk to any individual of adverse effect from the drug than there was risk of exposure to the disease, so I felt a bit conflicted. Story 43, ex-theater nurse here. There's a rare condition called malignant hyperthermia, which is essentially a severe and life-threatening reaction to anesthetic drugs. The antidote is dantrolene, which is bright orange. Expensive AF, kept on site at all times. I'm pretty sure there's a relatively small amount distributed across my state. However, since this condition is so rare, it often just expires. Story 44, former EMT. This reminds me of how paramedics answer the question, how was your day? Johnny, hey man, how's your shift going? Nick, I gotta give Solomedrol. How about you? Johnny set up a dopamine drip. We just got pulses back on a cardiac arrest. Nick, envy intensifies. Story 45, it was a while ago, but when I was a physician in the military, I prescribed Dapsone among a couple other unusual medications for a case of Hansen's disease, aka leprosy, that a Marine contracted in the Middle East. I was on the medical team caring for the patient, but I remember orthopedics being heavily involved because somehow the disease was in the bone. Edit for those wondering, in the West, while leprosy is a disease people hear about, because it's mentioned often in history, it's something you learn about once in medical school and almost never see in civilian practice. ID also add, I was not the person who made the diagnosis. I just did what I was told by my attending. I was an intern. Story 46, I don't remember the name of it. It's been almost 10 years. A hemophiliac suffered a traumatic amputation. We had constant blood transfusing, no massive hemorrhage, but he was steadily leaking. We gave him some sort of clotting factor replacement, and 4-dose 3 or 4 times a day. Pharmacy hand-delivered each dose. They ran about 5,500 each, I think. Right now, I'm giving a lot of Remdesivir. That'll be a cool story one day. Story 47, I once had to administer a certain type of blood product to a patient with an immunodisorder. Each dose was worth $5,000, and he needed 3. It also wasn't a complicated setup. If I set it up wrong, it would be a waste unusable. Long story short, I administered it okay with the most anxiety I've had in my 6-year nursing career to date. Fun times. Story 48, CAR T cells. Engineered T cells from a patient that are modified in a manufacturing center after being removed from the patient. Then rain-fused, the products on the market X-axicabagene ciloleucel goes for nearly $500,000 in the U.S. despite all the federal funding that went into its development. The approved products are approved for pediatric, a type of leukemia, and adult DLBCL, a type of lymphoma. Always interesting to click on the Show Charge button when I verify these. Story 49, I worked on a GI unit as a new nurse, and our last resort for really constipated people was a milk and molasses enema. I can't stand the smell of molasses now. The milk draws water into the bowel, and the molasses acts as a lubricant, if I recall correctly. You have to heat up the milk to mix in the molasses, and then let the mixture cool, otherwise you scald the inside of someone's rectum. When you administer one of these suckers, you do it in the bathroom next to the toilet or with a bedpan or bedside commode really close by, because they are quick and effective. More often than not, you end up with a major co-brown afterwards. Story 50, glucarpidase for reversing methotrexate overdose. Was able to give as there was unclear instructions, had to be ordered specially from the pharmaceutical company and wait for delivery directly to the ward. If I remember, it was about $50,000 for a 2 milliliters dose. Story 51 had a hospice patient who was getting a continuous infusion 3 and 4 for uncontrolled pain from their terminal illness. She was getting 30 milligrams of Dilaudid an hour. For those who don't know, a typical dose is like 5 milligrams. The pharmacist called me to clarify, and I even had 3 other nurses verify and sign off on it with me. And we had to outsource for the medication BC. This one patient was basically taking up the entire hospital store of it. 30 milligrams would probably take out an elephant easily, and she was just sitting up in bed talking. I think someone told me later that she had some metabolic disorder also that wouldn't let her metabolize pain medicine like normal people do. Story 52, antibiotics in a route. The entire unit, including me, thought it was a mistake, so we called the hospitalist. There was no mistake. The patient was bowel incontinent. It went as you would expect. Story 53, I was a hospital pharmacy intern, and I dispensed alendronic acid. It's quite pricey for treating osteoporosis, and it's a really weird drug to administer. It has to be taken in the morning only on an empty stomach. You have to remain standing for 30 minutes after taking it. It must be taken with pure water and no other beverage. Story 54, am not a DR, and I don't know if it's rare, but I'm the only person in my town that takes midodrine hydrochloride, which helps with my neurocardiogenic syncope. It took 6 months to get approved for it. Story 55, medical maggots. I'm a trauma nurse. Had a guy with a severely necrotic foot covered in ulcers once. Maggots eat away the dead flesh around the wound. I've used a leech on an eye trauma. Someone had to stay in the room with the patient while the leech was applied to ensure it didn't fall into the nasal passage or mouth. Story 56, pharmacist here. Medical grade cocaine to compound cocaine eye drops. There were 2 other people watching my every move. I did feel like Scarface a little bit picking up a 12-pound bag of pure cocaine powder. Story 57, medical student on a pediatrics rotation, and I didn't administer the drug myself for obvious reasons. Patient was diagnosed with spinal muscular atrophy. Certain forms of the disease are extremely detrimental and result in early death, unless you give Zolgensma. It's gene therapy and can give kids an honest-shot life, price to $1 million. Story 58, leukemia patient, here CML. To be more specific, I was on Gleevec and now on Sprycel. Every time I go to new urgent care, my CML makes me prone to infection somewhere, or someone new is working in my regular doctor's office. They always look at me very confused when I tell them the meds I am on. Are these meds? Not very common. They're stupid expensive as well. Story 59, albuterol tablets. Patient was on some clinical trial for an illness I no longer recall. Albuterol is a bronchodilator used in an inhaler formulation. Don't know of an indication for the tablets, but this fellow was taking several a day. Edit, his illness was not respiratory. Story 60, adenosine. The patient's heart literally stops for a while as intended. It is so weird to see the flat line. We use the drug to interrupt certain types of arrhythmias. Cardioplegia, stopping the heart during heart surgery, is super cool as well. Story 61, arsenic. Yup, straight up poison. I've actually administered it a few times over the years, but it definitely isn't common. It's used to treat APML, an uncommon subtype of acute leukemia. I'm an oncology nurse, so I deal with a lot of uncommon medications, at least as far as the rest of the world of medicine is concerned. Story 62, hospital pharmacist here. Had a baby with congenital hyperinsulinism, pretty much a neonate who by a genetic defect just provides more insulin than they should, resulting in low blood sugars and all the bad side effects involved with that. We used diazoxide to treat him, which messes with the ADP channels on your pancreatic cells and inhibits the release of insulin. He ended having to go home on it long-term and boluses of dextrose as needed. Story 63, I've seen some weird stuff. 20 years ago, a patient actually had a doctor's order allowing him to smoke in his room, recovering from vascular surgery, different patient. About 5 years later, was having a beer. It came with his meal and was ordered by the physician. I was curious and checked the pharmacy formulary, and sure enough, Miller Lite, Hacker Score, and Stoli Vodka were available in the pharmacy. Story 64, kind of unrelated, but I'm a nurse in Pittsburgh, and I had to admit a man who wanted to donate his kidney. Normal procedure is to administer opiates as pain medication, but this patient happened to be a detective in the DEA and would not take anything that was even remotely addictive. What we ended up doing is pumping him full of 4 Tylenol, like a stupid amount. The guy came out of the thing just fine, and he still stood by the decision after the operation. TLDR, guy didn't want any painkillers from kidney transplants, so he just took Tylenol. Story 65, arsenic, to a stage 4 breast cancer patient. I just got chemo certified and was working at a big hospital oncology unit. It made no sense to me, but they were desperate. I kept asking the patient if she was sure. She died not too long after. Story 66, gave anakinra, a very strong medication to short-circuit the immune system. That same patient got methotrexate, which is actually common, but in this case, I had to do a lumbar puncture and get into the patient's spinal fluid and give the methotrexate in the spinal fluid. Story 67, just asked my SO-DR. He said when working in palliative care, he has prescribed the odd wine gin. If the person wants it but has no family to give it to the nurses, etc., are busy, but if you prescribe it, they have to administer it. Story 68, antitoxin for botulism. Had to go to the airport to receive it from the CDC and rush back to administer it. Closest I've come to a TV medical drama. I was asked to repeat the story for months after. Story 69, I had a patient once who had dressing changes with the dressing soaked in this weird bright purple solution that stained anything it touched permanently. She had necrotizing fasciitis flesh-eating disease that was complicated by a reduced immune system response due to chemotherapy she was getting for cancer. I don't remember the name of the purple stuff. I only saw it used that one time in 17 years of nursing. We spilled a little bit on the floor, and the doctor said that the floor would always be purple in that spot. Story 70, hydrochloric acid drip in a MICU during residency. I honestly don't recall the exact clinical circumstances that led to this dude getting so alkalemic, but I do remember him getting obtunded out of nowhere only to find an arterial pH close to 7.7, required direct call between our conservative attending and pharmacy before it was approved. Story 71, ethanol to an infant. As a central line lock, I took care of a baby born with gastroschisis, which resulted in short gut syndrome and malabsorption. The child received TPN via a central line 12 hours a night at home. He had so many central line infections from his parents' inability to properly care for the central line that now his access sites were very limited. When he was down to the last site, I was sent into the home twice a day to teach the parents and manage the line, make sure the dressing remained occlusive, and start and stop the TPN, which included instilling a small amount of ethanol into his Broviac when not in use to prevent infection. Story 72, vodka. Gave one time because patient was withdrawing and wanted to prevent seizures and his heart rate was insanely high. Watching someone go through alcohol withdrawal is pretty harsh. Story 73, not really a rare medicine, but a rare occurrence. I worked in the emergency room and had to deliver rabies treatment twice in one day for 2 separate unrelated wild animal bite incidents. Story 74, not a doctor, but my best friend has some autoimmune issues so rare and confusing nobody has managed to diagnose him yet. He used to be in an early stage study on some drug made from hamster ovaries, and it worked reasonably well, but then he had to stop because it's suppressing his immune system, and he'd be dead multiple times over if he catches COVID while on the drug. If he catches it now, he's only like 85 dead. Please wear a mask. Wash your hands and stay away from crowds, you ingrates. Story 75, not a nurse, but the patient. In 2018, 13 years old, I had a case of severe pancreatitis. Worst pain I've ever felt. I remember rolling around on the floor of the sick bay. I could barely breathe. It felt like I was getting kicked in the stomach. They ended up giving me a large dose of ketamine. I felt dizzy and sleepy. According to my mom, who is an ex-registered nurse, they don't give ketamine to patients that often anymore. Edit Envium, I realized ketamine is actually pretty common. Story 76, I was asked to prescribe dinitrophenol. It's basically a poison, but the most potent fat burner there is. It's used by the bodybuilding community for fat loss. It's not currently legal, even for doctors to prescribe. So I had to decline. I have prescribed HCG, human chorionic gonadotropin, for weight loss. It's a hormone secreted by women when they're pregnant, but also a good appetite suppressant. Story 77, pharmacy tech here. One I haven't seen mentioned is Heman. It's mainly given to our patients in our outpatient infusion center, but has been ordered inpatient before, such a pain to make, and is only stable for an hour. Story 78, eculizumab. Used in certain uncommon autoimmune diseases and a few common ones. It's normally only used in life-threatening diseases or for patients refractory to other treatments due to its extremely high cost. For 1 year of treatment, it costs $500,000. Story 79, had an EOL cancer patient that took opium tincture for diarrhea. Nothing else seemed to work. Had another patient who regularly picked up thalidomide about once a month or so for nausea. Again, someone for whom nothing else seemed to work. Then there was cocaine HCl, widely used by one of the surgery departments as a vasoconstrictor. Story 80, I've been involved in a few cases of giving bacteriophages to patients. I've ordered a bunch of restricted, highly expensive antibiotics such as Zerbaxa, Vabomere, Recarbio, Avicaz, although those aren't uncommon within my specialty. I've given Firazyr icatibant a couple of times for angioedema. I've taken care of patients on experimentals or highly rare drugs for metabolic disorders. Nephrologists could probably brag about the time they gave Soliris, or CF pulmonologists about some of the rare stuff they give in CF. Story 81, chloramphenicol for a dog point with a really bad skin infection that was not treatable with other antibiotics. It's really rare when we have to use this and very dangerous to handle. Story 82, we dispense actual opium for a guy at the pharmacy I work at. It's in a liquid form, and he does take a super low dose at a time, but it throws me for a loop each time Git comes in with a new script. Story 83, had a patient come into the ER with very mild abdominal pain. I asked when it started, and he said right now. He didn't have a coherent answer when I asked how he knew to come to the ER if his pain just started now. I still don't understand what brought him in. It was an all-around odd encounter, and he left pretty quickly. We didn't do anything for him. On a side note, he complained about the wait. He waited 12 minutes after he checked in before I saw him. I checked the records. I'm not exaggerating. Literally 12 minutes. Story 84, maybe not rare, but digitalis. For an infant less than 3 months old, had to go to a special pharmacy because they had to make it specifically for the patient. That was 24 years ago, and the child is an adult now. Story 85, whiskey. Not rare, but rare as a medication. Just a dying patient who wanted a drink, so I went and got him a bottle at the liquor store to keep by his bed. Story 86, dantrolene. Every medical student and their dog knows it's the treatment for malignant hyperthermia caused by anesthetics. But it's a super rare reaction. So rare that there's a MH center that everyone calls when they have to administer it that coaches them through using the drug. Story 87, I'm a NICU nurse, and our unit has given Zolgensma injections to babies diagnosed with spinal muscular atrophy. It's given as a one-time for infusion over an hour and costs $1 million, but don't want that for going bad. It's an amazing treatment that was approved last year and seems to cure SMA. Story 88, late to the party, but a coworker of mine gave Zolgensma. It's the drug that came out last year, cost over $2 million. Kid is doing fine last I heard. Story 89, scorpion antivenom. Not actually super rare, but costs about $3,000 per vial, and I administered 3. I can tell you that I read those directions at least 3 times and consulted a few other people before I actually mixed the med and gave it. Story 90, Korlym, aka daily mifepristone abortion drug. Not a doctor, but a patient with Cushing's. It is extremely expensive dispense for this use at around $30,000 to $60,000, depending on dose per month. It lowers cortisol and saved my life. I literally swallow 2x the abortion pill daily. Story 91, years ago, I saw a patient in an outpatient VA clinic who showed me an empty bottle of Obcalp and asked for a refill. Medical records had misplaced his chart, not unusual. I had to apologize and go find a pharmacist to learn what it was. I felt kind of conflicted, but issued the prescription. Story 92, I am a doctor. I've ordered anakinra for 1 patient during my career so far. It was for systemic juvenile idiopathic arthritis, SJI at the time. It cost like $8,000 a month. It's still not that common of a drug. Only used for SJI, ankylosing spondylitis, and really severe RA. Story 93, I don't know why I'm surprised that rarest least common equals most expensive. Maybe I was expecting a story where a dust bunny was the miracle cure. Story 94, Yakult. Patient with dementia had C. diff, and that horrible green color would end up on his hands and everywhere he would touch, and head. Try to grab your arms if he got close. We have him a small pot of Yakult 4 or 5 times per day, and it stopped it. Cheap whiskey for an alcoholic, 25 milliliters every night. Story 95, this doesn't really have a lot to do with the question, but since so many medical professionals are here, I have a personal question. I'm on testosterone cypionate, 50 milligrams injection, 2x a week. I also work nights and tend to sleep a lot during the day, so sometimes I end up missing my injections. Is it okay if pre-file my syringes for the week for my medicine, then stick them in the fridge until I'm ready to inject? That way I can save time, not forget as easily. Story 96, in the NICU, we give sildenafil off-label for high blood pressure. Usually used in adults, similar to Viagra. I've never noticed if it has the same side effect on our male babies.